Okay, now let us have another pharmaceutical class discussion of today. And today's lesson is about anabolic steroids. Most of the time during you're walking up and down the street of Mombasa, you're seeing a lot of people with big bodies. You hear that they are getting steroids, and let us see now this thing, which is called steroids, they are using drug to make their body big. Let us see how they work and what is it, and let us see the truth in it. So our topic today is about anaerobic steroids. And by the end of this class, you should be able to understand the list of anabolic steroids, explain the pharmacological basis of use of anaerobic steroids, list the side effect of anabolic steroids, and list the contraindications of anaerobic steroids. So let us see, and let us see um, our knowledge is on this one. And the first question is, which of the following is the male sex hormone? Is it estrogen, testosterone from both A and B? The answer is testosterone is the male sex hormone. Which of the following is not an effect of testosterone? Development of sexual characteristics in male, yes, and growth of spot in male, yes, increase in the erythropoiesis in female, and then fusion of epiphyseal in males, that is D. So, anaerobic steroid are synthetic androgens. They have high anabolic activities. Anabolic means that they don't need oxygen for metabolism. They are less selective in human being, and androgen activity is 1 to 3 are indicated in the scenario requiring only the anabolic effect of the steroids. Anabolic steroids are classified as 17 alpha acyl substitute compound, and examples of this one is oxymethyltron and stanozolone. The others are methadone and nalodrone. The mechanism of action is that it is similar to testosterone. It's similar to testosterone, and they work inside the cell where the androgen, because it's an androgen, it gets attached. It enters the bond in the cell. The cell then it gets attached to the androgen receptors. The androgen receptors. Then after that one, it is presented as androgen complex. It is represented as a androgen complex dimer. Then it enters the nucleus. Then in the nucleus regulatory site, it is converted into transcription and DNA to mRNA. Then translation messenger RNA, and then it comes out and then causes androgen effect. So it acts by binding to the androgen receptors, interact with the androgen response in the cell, modifies the gene expression present of a co-activator and co-representer. Examples of this type of drugs is in the market is methadone, which is oral tablet 2 milligrams or 5 milligrams. It can also be in oral drops 2 milligrams per ml and intramuscular injection to 5 milligrams per ml. Nandrolone is intramuscular injection 10 milligrams per ml, 25 milligrams per ml, or 100 milligrams per ml. The other preparation is oxymethylone, which is 5 milligrams, 50 milligrams, and 50 milligrams. That is oral tablets. Stanozolone is oral tablets, 2 milligrams, or intramuscular injections, 50 milligrams per ampule. So they are used in catabolic states, like in acute illness, cancer, cachexia, major surgery. Also, it is used to reduce nitrogen loss, and also transient response is only seen, indicated for short-term therapy. It's given for short-term therapy. So anabolic steroid basically they are used in things like osteoporosis, in elderly male due to prolonged immobilization, and the drug preferred for osteoporosis in elderly males due to prolonged immobilization is alendronate and zoledronate. The suboptimal growth in boys, brief spurt in linear growth seen useful in hypogonadism. The best one is somatropin. And in anemia, hypoplasmic malignancy associated with hemolytic, to increase HB is this erythropoietin, and which is also commonly used in end-stage renal failure, because in end-stage renal failure, there is no hemopoietic activity, so it is also given in that. So, misuse, this type of drugs are abused in athletics because they assist the people. Steroid plus exercise increased muscle strength. They have a short-lived effect and also uncertain improvement in performance and considered illegally in Kenya, included in dope test, which we hear very much being discussed in the world of sports. The side effect, they can cause cholesterol jaundice, they can lower high density lipid and increase lipid density. That means they interferes with the cholesterol metabolism. You know that very well that we like the body to have high density lipids because high density lipids works as a transporter, and we don't like low density lipids because it's a bad cholesterol in our body. So vitalization, excess body hair, and menstrual irregularities in female is very common, and also sodium retention and edema in people is very common. So it can also cause carcinoma of the prostate, it can cause carcinoma of the male breast and liver, and also kidney diseases, and also is not given in pregnancy. Future prospect about these drugs called steroid there is that selective androgen receptors modulators like ostarine, androgen are high anabolic androgen ratio, and complete phase 1 and 2 clinical trials is undergoing, and because they decrease high density lipids and increase AST and ALT in the river. So they are not approved in use in ASA up to date, and they are considered, the food supplements are considered illegal. So in this case now, there is a lot of studies which are done in this type of drug to see whether there is something which can happen about them in this type of drug. So conclusion is that anaerobic steroids are a synthetic androgen with a higher selective for anaerobic effect. They are used for brief duration during catabolic state. They are used to boost athletic performance in vivo. SARMs are most selective from anaerobic effect of androgen. Thank you for listening to this lecture. Thank you very much.